Hello, welcome to hajjatoppathology.com Case of the Month series. It has been a little bit busy for 2 months, so after 2 months now I'm going to share another soft tissue case, and this case has some important features that we have to be careful both during microscopy and macroscopy. So the tumor was infiltrative. There were some nodular infiltrations into the straightened muscle, and as you see, the tumor seems to be myxoid and multinodular or vaguely nodular pattern. Of course, as we see the necrosis, it exerts the malignant potential in this low power field, and some areas has some thick vessels and looks like myxofibrosarcoma vessels, and some areas have some hemangioparasitic areas. And in the low magnification, we have some vessels looks like herniated, and if we go to the higher power field, there's not so much nuclear pleomorphism. This is unexpected, but there's some scattered hyperchromatic cells, and I'm going to wander around, and you see the tumor. The cells are spindle, and they have some bipolar cytoplasmic features, and some other areas. I'm going to pass another slide. As you see here, of course it's cellular, and we have some areas resembling fibrosarcoma with like a very nice herringbone pattern here, and of course the diagnosis of fibrosarcoma in an adult is highly discouraged. As you see, we have mitotic figures here. By the way, this patient is a 50-year-old male, and this is a lower extremity tumor. A lot of mitotic figures, and these are fibrosarcomatous looking areas. And again, we have here another area. The cells try to herniate into a vessel, and in this slide, these areas quite resemble perineuroma, as the cells have these bipolar extensions, and now, although in this slide the tumor seems to be encapsulated, this is a pseudocapsule, and I'm going to show Desmin staining, and this highlights how the tumor infiltrates into the muscle cells. And this is the first pitfall that the soft tissue pathologists or surgical pathologists have to be aware of. Here, the tumor infiltrates into the among the striated muscle fibers, and this may lead to the false diagnosis of a rhabdomyosarcoma. And now I'm going to show also myogenin here. Also, the myogenin may also be positive in degenerating muscle fibers. And then after we see this case and under microscope, we turn to the microscopy, back to the microscopy, and try to find this the tumor's relations to the nerves and other structures, and we found this little outpoaching, and we take a section from that area, and this is the second important information about this case, that as we sampled that area, we have found a very nice peripheral nerve relation of this tumor, and I'm going to show you now. This is the origins of the tumor, and it turns like hippocampus and then it enlarges, and then this is the tumor that we see. So the macroscopic examination is very important in order to reach the correct diagnosis. And this tumor, when we applied the immunohistochemistry, it was again a little surprising, but it was negative for S100. As you see here, this is the nerve, and the nerve infiltrated by a tumor, and then so the stained fibers are the remaining fibers of tumor cells, remaining fibers of the nerve, and the tumor itself is negative for S100, and not only for S100 but also SOX10. SOX10 was also negative. So this finding, when we consider this finding with the perineural-like morphology, and this is EMA, nicely highlights the perineural cells. It has also some the tumor cells. Some tumor cells also stain with this EMA, and also other perineural markers stain at least some of the cells. This is CD34. The positive, the tumor cells are positive for CD34, and I'm going to show now the collagen 4, and this is a perineural, the normal nerve, and some of the spindle neoplastic cells were also positive for collagen 4, although many of the stained areas represent the vascular areas. And lastly, GLUT1 was also positive, showing the perineural differentiation. the take-home message for this case is the first one is do not be fooled by the desmin positivity around the tumor. That is that might represent the infiltrative zone. The second is macroscopy is essential for the diagnosis.